Hello, my name is Destiny. The communication that I chose to go with for this project is understanding breast imaging. My goal is strengthening communication and health by educating women about breast imaging to improve their healthcare choices and outcomes. My inspiration for this communication: I have been a mammotech for the last 7 years, and I never realized how many women are affected by breast cancer. This can be a scary and confusing time, especially when you don't understand what they're talking about. There are communication gaps due to the lack of information that is publicly known, and patients often make healthcare decisions based on wrong information, no information, and these can have negative impacts on their health. Communication gaps, these are some of the common questions and concerns that I hear. Many women believe that breast imaging and breast cancer is a one size fits all. Most do not understand the vocabulary used in the dictated report. Most do not understand the difference between mammo or ultrasound. Many women believe that ultrasound is enough or better than mammo. Many women believe that you age out of mammography without realizing cancer does not stop at a certain age. And actually, your chances increase the older you get. Most believe you are only at risk if you have a family history. How communication gaps can have negative impacts on your health. A lot of this kind of reiterates what I just went over on the other page, but each year brings a new opportunity for disease to occur. More than likely, you are not being called back to repeat the same pictures. We need additional pictures for a specific reason. Mammo is considered the gold standard. Ultrasound is not enough to image the entire breast. It does not show small calcifications. And then again, you don't age out of cancer, so stopping your mammograms at age 65 can have a lot of serious health consequences for the older ladies. And then 80 to 85% of those diagnosed do not have a family history. And then another communication gap: understanding your callback letter. This is a sample letter that I pulled offline. It's a little vague, but it's not as vague as the one we use. Your recent screening mammogram showed a finding that requires additional imaging. And then it doesn't explain what or why you would need additional imaging. The letters at my office tend to be a little more vague than that. They will say, your results are inconclusive, and it doesn't explain or give any urgency to the letter. Some women can brush it off, not realizing how important it is that they come back. Another communication gap with the letters. This is the letter that goes to the patient, really vague. This is the letter that goes to the doctor, the nurse practitioner, whoever ordered it. It is a very detailed report. I'm not going to read the whole thing for you, but reports do not come with images. I specifically picked out this one because it did. And I'll explain why in just a second. Most people would not understand the conclusion if they tried to read this. High density 2.5 centimeter, irregular shaped, indistinct spiculated margin mass. sounds like a whole lot of words and people don't understand the meaning. Communication gap. Women are never given the chance to see their images. GE has started to include the option to add thumbnail pictures to the reports. The mammographer is not legally allowed to explain anything seen on the images, therefore, most techs usually avoid showing pictures since you can't say anything or comment. The radiologist is the only one who can comment, and they do not have time to play show and tell with every single patient. Should we push for imaging? Would including images with the reports close the communication gap? Women would be able to see what we see. Creating a solution. My solution was healthcare workers, especially radiologists, they have a whole lot of information. But how do we condense this information down into something that patients can understand why it's important? So my solution was this little brochure here that will highlight some of the common, most important breast terms, and then patients should understand the importance of their report before making a decision. Spreading the word. The American Cancer Society hosts a breast cancer walk called Making Strides Against Breast Cancer. Teaming up with them would give access to thousands of people across the nation. This would also reach the hands of other medical professionals, doctors, nurses, people who would be able to help explain and have a visual aid in their hand when they are explaining reports to patients. My expected outcome: faster response time for callbacks, increase participation from women with no family history, and then keeping our older population coming for their annuals, and then keeping women informed and included. And this is the little brochure that I made. Made a little example here for you. This would be the front cover right here, Making Strides, and then it will explain screening mammogram saves lives. And then it'll have two what I consider important facts on the back here. And then communication tools to understand your mammogram results, explaining breast calcifications, explaining asymmetries, explaining a lump. Those are common terms that are put into the report, and a lot of women do not understand what asymmetry or calcifications, like what the importance is. And then the very when you open it, this would be the inside. Your cancer types. This can be important to know because this will determine the treatment that you're eligible for. Most breast cancers are hormone positive, meaning that they respond. There's a very scary type called triple negative, where it doesn't like to respond to anything. BRCA1, BRCA2, explaining risk factors. And then mammogram versus ultrasound, explaining some differences here, and it has some visual aids along with explaining breast density. I feel like what I have in the brochure are some of the most common information that women would need to make a decision. Thank you.